Firstly, what a special time. You're taking the first steps to start or expand your precious family. And I'm proud of you for doing your research before becoming pregnant to enhance the health of you and your future little bub. Folate is a key nutrient for pregnancy, and as such, it's recommended that you take additional folic acid supplements during your first trimester of pregnancy. But you may be wondering whether it's worth commencing them prior to conception. In short, the answer is definitely yes. In this video, I'm going to discuss the importance of folic acid supplements and a folate-rich diet before pregnancy, so stay tuned. Hello, if this is our first time connecting, welcome. My name is Melanie McGrice and I'm a fertility and prenatal dietitian. I help couples boost their fertility and give their babies the best start possible with the power of good food. I post weekly videos on nutrition tips for fertility, reproductive conditions, pregnancy and new parents, so make sure that you choose the playlists that best suit your needs and binge watch my previous episodes. But make sure that you subscribe to be alerted about future topics. Now in this video, I'm going to discuss 4 key benefits of folic acid before pregnancy. So let's dive in. Benefit number 1. Now, this one is probably the most obvious, and that is that consuming adequate folate before pregnancy greatly reduces your risk of neural tube defects. Neural tube defects occur when the brain and spinal cord do not fully develop. Did you know that when you first become pregnant, the neural tube is the very first part that develops in your growing bub? Therefore, it's vital that you have adequate folate stores from day 1 of pregnancy. And most mamas don't know that they're pregnant until your baby is at least 2 weeks old, and by then you've missed out on some vital time. By focusing on your folate intake prior to conception, you'll reduce your little one's risk of developing neural tube defects such as spina bifida or a cleft palate. Which leads me to benefit number 2. Optimal folate intake prior to conception is essential for optimizing your chances of having a healthy baby. As a fertility and prenatal dietitian, I've seen firsthand how difficult getting pregnant can be. Well, I'm going to let you in on a little secret. Folate is vital. If your bub's neural tube doesn't form properly, it can sometimes result in either a chemical pregnancy or a miscarriage. And just in case you're unsure of what a chemical pregnancy is, it's a very early miscarriage that happens within the first 5 weeks of pregnancy, when many women don't even know that they're pregnant yet. We want to do everything we can to avoid this, and so this is another reason why I encourage you to optimize your folate intake before becoming pregnant. And now for benefit number 3. Emerging research suggests that there may be a link between inadequate folate intake and an increased risk of autism or autistic traits. The link between these isn't specifically clear. However, from what we know about the importance of folate for our little one's DNA, it isn't surprising that this association has been made. To make things even more confusing, researchers suggest that there may also be a link between excessively high intakes of folic acid and an increased risk of autism spectrum disorder. So, the best advice is to get personalised advice from your fertility dietitian about the best form of folate supplements, especially if it's taking you longer than hoped for to conceive. Fourthly, research suggests that an optimal folate intake before pregnancy may improve the birth weight of your growing bub. Generally speaking, poor nutrition before and during pregnancy can contribute to the risk of having a low for birth weight baby. Folate, however, is particularly important because it plays an essential role in the creation of DNA, which is your baby's genetic material. When a baby is born small for their age, it can contribute to a host of other health complications in the future. You may like to check out my video on small for gestational age babies during pregnancy for more info. Now, I know that you want the absolute best for your baby. Therefore, given folate's important role in growth and development, I highly recommend ensuring that you have the right amount of folate for your personal needs. Now, I know that your next question is going to be, well, how much folate do I need? The answer to this will change from woman to woman based on a range of factors, such as how long have you been trying to conceive, how long is it since your last pregnancy, how is your weight tracking, and whether or not you have any medical conditions that can impact upon your folate stores. So get personalised advice from a fertility dietitian. Additionally, if you're confused about the difference between folate, folic acid and other types of folate, check out my video on folate versus folic acid. Now, to help you optimise the folate in your diet, I've created a free fertility meal plan just for you. Go to melaniemcgrice.com/fertility. You might also like to check out some of the delicious folate-rich recipes on my website. And don't forget to subscribe to my YouTube channel. I'll look forward to seeing you in my next video. My previous episodes. Sorry.